Welcome to Unleash Your Inner Goldilocks, How to Get It Just Right. Thank you so much for joining us for another exciting and invigorating conversation about how to get things done just right. Today's conversation is going to be about the innovation and evolution in the healthcare space. The healthcare system is broken in so many ways. And I always wonder, why do we keep calling it health care when neither health nor care is at the center of it? It's all about maintaining the symptoms so that we can sell the pharmaceutical drugs, we can continue with the treatment, because the profits are made at that repeat provision of services and products. How do we take that and pivot to healthcare so that we can address the cost, the escalating cost? We can address the wellness of everybody involved, from the providers, doctors, nurses, healthcare workers, patients, caregivers. Everybody's wellness is put into jeopardy. How do we bring in quality? And where human capabilities struggle to handle, how do we best integrate technology? And how do we make technology our ally? And leveraging that tech-human partnership, can we address some of these dilemmas? You're absolutely going to love our conversation today. And to delve into this is a good friend of mine. I consider him a friend. We've known each other for a while now. Raji Akileh, who is not only a medical doctor coming from the healthcare field, but he has taken his passion and affinity for technology, and he is being the driver of change in this place. And I'm honored to be collaborating with him and facilitating, in my own way, this journey, because each one of us have a stake in this. Raji, welcome. Welcome to Unleashing the Goldilocks.
Thank you so much for having me. I really appreciate it.
So as we get started, can you take us back to, how did you go from medicine, being a medical student, going through the rigorous education to become a medical doctor, to jumping into this innovation space and young? Most of the time people wait till they get burnt out, then look for a relaunch. But you were somehow wise enough and tuned in enough to understand the need to blend the two up front.
Mm-hmm. Yes. So, I'll be happy to, as the conversation moves along, discuss the story, but at a high level overview, I always envisioned that I would be in clinical medicine, not outside in the innovation space, and so forth. I wanted nothing more than to become a pediatric oncologist, so cancer for children. Growing up, having several family members pass away from head and neck cancers, I saw the horrible side effects that chemotherapy had on my loved ones, some of the downstream effects, and then ultimately leading into hospice and so forth. And I wanted nothing more than to prevent that same level of pain and suffering that I felt, and the helplessness I felt as I watched my loved ones deteriorate, preventing others from having to go through that pain. And when I got into medical school, I had this vision of what medical training was supposed to be, coming from a single mother of 3 children, having overcome significant adversity in life, and to be honest, not even thinking that medical school was a possibility because of the financial challenges before me. I guess you could say embraced what medical training was supposed to be like in my mind as something it wasn't. And when I got into medical school, I quickly realized that medical training was broken in its current state in 2016. And ultimately, there's a cascading series of events through my medical school that helped make the decision for me to dive into the world of entrepreneurship and startups to fix healthcare.
It's fascinating to hear you say that. I have being the caregiver for a cancer patient husband, as you and I have talked about. And I personally made the choice not to let him go through chemo. And I brought him back to remission with food and lifestyle change. And it is possible. So talk to us about, as you delve into this, there are so many different ways to address health scenarios. First, preventative. And once you get the illness, there are different ways to address it. There is no singular approach. How has understanding that shaped you?
Yeah, and that's the thing too. When it comes to each individual patient, we cannot just treat every single patient the same way we treat in a cookie cutter approach. The patient comes with a very diverse background of upbringing, lifestyle choices, genetic profile, and so forth. And treatments and interventions need to be tailored towards every single particular patient that's sitting in front of you. When it came to the treatment side of, for instance, my family members and the chemotherapy, I noticed a very interesting dynamic. There's definitely regimens that are very effective, and I'm not discounting it, but I said there had to be a different way of approaching the patient care when it came to this, and I started to become really fascinated in the area of regenerative medicine because I've always looked at how the cancer evades the immune system regulation and so forth. I've always obsessed with the molecular world there. And I knew there had to be more targeted ways of addressing the patient without actually just carpet bombing with chemotherapy. And some of these advances within CAR T therapy and more targeted therapeutics, which got me into the regenerative medicine space, it's treatment is just one aspect of many things. There's also nutritional intake, there's spirituality, there's a whole host of items that need to work in unison and together to optimize outcomes for the patient. And so to just say, let's just give them chemotherapy and see what happens, unfortunately, is a recipe for disaster. You need to address them holistically. And that's kind of why I gravitated towards the DO profession in particular, because I really appreciated the tenets and the core philosophy of the mind, body, spirit as being a single unit. So
as you say that, it's music to my ears because I grew up in the Ayurvedic tradition, and we are a whole human being, right? So when we forget the mind and the spirit, the body goes along when the spirit is willing. And so I'm a believer, and I grew up in the tradition that you approach life holistically. And so I see that you've taken that holistic approach, your medical training, and then you've also layered in technology. Talk to us about what brought you to a point of understanding the power and value of technology in patient care, in quality, and cost reduction. It affects all aspects of healthcare. Talk to us a little bit about that, and then we'll jump into the innovation, what propelled that innovation.
Yeah, so when it came to the technology aspect, I noticed very quickly that medicine was rapidly changing back in 2016. I saw that the needs coming out the other end in residency training and attending practice, etc., were changing very quickly prior to the COVID breakout, but COVID just exponentially accelerated it. And I saw that there was zero emphasis on training our healthcare professionals to leverage these technologies. It was pretty much focus on your board exam, don't think of anything outside of your examinations. And I felt like there was a mismatch between where healthcare was heading and where we currently were. And if you think of downstream effects, we need to not only know how to manage and leverage technology, because, when we think clinically of downstream effects of pathophysiology and interventions that need to occur and, diagnostic choices and the different components, we are doing the patient a disservice when we're not amplifying our abilities as healthcare professionals for the patients, leveraging our clinical expertise and knowledge. Because, there's only so many things humans can do, and there's only so many tasks we can juggle before we start to burn out, fatigue, etc. And I see technology as not a replacement to our ability and our human touch, but an amplifier of that. And so I saw a very big need to train our future healthcare workforce to leverage those technologies so we can have a bigger impact downstream and impact patient outcomes.
I love that you always focus on impact, Raji. And I totally concur that technology is not the enemy. It's not a replacement. It just allows us to do the things that the technology can do better so that we can focus our human capabilities where that is needed, right? Because there's only so much a human can do with. And when we get burnt out, when medical professionals get burnt out, it has a direct negative impact on the patient and patient care. It affects quality. And so it makes sense. And even for the healthcare corporations, they have an upside because when there are less errors, there are less lawsuits, there are less payouts. And when the quality improves, profitability improves. Mm-hmm. There is cost to poor quality. And how are you seeing both the corporations that run the healthcare services and patients on the other side, right? How are they absorbing this notion that technology and human capability alongside the medical training, healthcare training, they need to be integrated for a whole person's wellness?
Mm-hmm. Yeah, so when it comes to identifying both the corporation and then the patient on the receiving side of care, there's some considerations that need to take place and some insights that need to take place. When you talk about the corporation, obviously, at the end of the day, whether you're a for-profit, a not-for-profit corporation, you need to keep the lights on. You need to ensure that your employees, they have a reliable salary and so forth. So that way they can put food on the table for their family members. So at the end of the day, this whole notion of profit being evil is a misnomer, because I have seen some for-profit companies do amazing things for individuals, but I've seen some not-for-profit organizations do horrible things and self-serving things. And so one of the things that, when it comes to the technology aspect for the corporations, is, obviously it will help reduce some of the overhead and the expenditures and so forth, but also it drives brand because when you have better health outcomes as a result of properly implemented technologies that extend the capabilities of the healthcare professionals and thus improved patient impact, you have an affinity that is developed by the people relying on the services by that corporation. They say that, I was in a very vulnerable and desperate situation. I was at a very low point in my life and I needed help. And I got the help, and it was a very good outcome as a result of coming across this healthcare entity. So there's a branding component and affinity, which drives loyalty. Then, of course, the patients will refer their family members, their loved ones, to that organization when they need it. Now, when it comes to the patient side, there is a level of education that needs to take place. The patients, unfortunately, as a medical student, when I was in the room, I noticed that the patient often conveyed to me that maybe because they saw me as an equal compared to the physician at the time when I was training, they said that, I don't know anything about my disease state. I don't know what's happening to me. I feel that if I were to ask a question, the doctor would judge me or think maybe I'm dumb for asking a certain question at a certain way. And I just don't know where to begin. And of course, I noted this on the examination and see how they interacted with the doctor. But what I noticed is the patient would then hide information and say they knew information about the disease, even when the doctor then asked, "So, do you have any questions for me, or is there anything I can clarify?" And it was because of that fear of being judged by the healthcare professional. And, of course, I intervened and made sure that they were fully aware of their need for the disease state. But when it comes to the technology, there's a lot of misinformation online about, robots are going to take over the world and everything like that. And so there's a little bit of, they come from problems with the healthcare infrastructure before. So there may be some layers of mistrust. But then if you amplify that with what's happening currently, now you have to go an extra mile to explain to the patient, some of the components of the technology and why it will help and versus harm them.
So that's a very, very insightful layer of information, Raji. As you move forward with this innovation, the new way of doing things, what can you share with the community in terms of educating and getting them excited so that they can, in their own way, be allies, be amplifiers, and be a support system to lean in from wherever they stand? Because it's going to take all of us to make this transformation happen. Help the community understand what to expect and how they can be a part of the solution.
Yeah, definitely. So, going down this route has definitely put a few gray hairs on my head. I did not anticipate that this would be as stressful as it was, but healthcare is deeply entrenched in problems that need to be addressed and that are very hard to create solutions for. And one of the initiatives that I got involved with, being on the board of advisors for Global Health Impact Network and Funds, it's a global network of healthcare professionals driving innovation in the medical field. We have communities all across the spectrum of healthcare and different even sub niches. And then in addition, we have venture capital funds for portfolio companies. So pretty much I got involved with them. And then I joined up with the organization. And currently I'm working to, I guess you could call it pre-launch stage ahead of my release of what's called MedEd Cloud. And we're initially leading with the MD and DO profession and nursing. And we have a roadmap for adjacent verticals, you could call them, and the life sciences a rollout phase. Now, one of the things that we're working to do essentially with the MedEd Cloud and Global Health Impact Network is I'm looking to fundamentally, you could say, and I hate to use this word because it brings a lot of fear to people, but revamp healthcare training. There's a lot of gaps that are missing inside of our current day curriculum. And there's a lot of need to support, our future healthcare professionals as they embark on their journey, not only from an educational level, a spiritual level, holistically support them and nurture them while they go through their journey and beyond. So one of the ways that I recommend at this current stage and getting involved in helping out is to learn more about the Global Health Impact Network. We will be releasing information on MedEd Cloud in the very near future. I've been very fortunate to work with some amazing people, including yourself, in this journey, and we will be rolling out information on how people can get more actively involved in this initiative. But there is a link, and I can include that to join the network as well for free, and I'll make sure that that's available after the.
Oh, that would be fantastic. Thank you.
Definitely.
So before I open this up to a conversation with our audience, I know they are waiting to be able to talk to you and get some additional nuggets of wisdom from you. How can people get a hold of you? I know you're going to provide us the link to the network, but how else can they directly reach you?
Yes. So, I always jokingly say I live on LinkedIn. So, I'm pretty easily responsive on LinkedIn, or try to be as responsive as I can, as quickly as I can. But, in addition to that, I can also provide any contact information that can be released as well for, if someone wants to reach out via email or anything. I always encourage people to reach out, connect with me. I love connecting and just learning about others' backgrounds and some of the challenges they faced in healthcare, because as you said, it is going to take a lot of people, and it's the insights that in these intimate conversations I have with people that open my eyes to things that I may have not experienced personally, or challenges I haven't experienced. And so I like to discuss, multiple walks of life to see how they overcame their challenges, what they would do differently, and so forth. So definitely looking forward to, getting information out so people can reach out. So.
Thank you. Thank you, Raji. So opening this up to the community, go ahead. Go ahead and ask any questions or thoughts that are in your mind. Let's go.
I was waiting for Nandini to hop in. So how do you, what have you found some of your biggest challenges in getting people to look at another way of looking at health and looking at other resources besides just only going to the doctor? I mean, I totally believe in Western medicine. I believe in all the great technology we have. I also believe that, everything that you're talking about is absolutely vital as well. So how do you get people to make even a slight shift towards, I might look into something different?
Yeah, like when it comes to, I guess, straying away from the norm and, what everyone is used to, you have to also look at what are some of the, you would say, frameworks that through which we base our beliefs off of. So, for instance, in Western medicine, everything is very empirical, evidence-based, and there's a hierarchy of information that builds off of each other and grows off of each other. One of the things, the misnomers in Eastern versus Western medicine was the fact that, as a Western society, we feel that there's superiority to Western medicine versus Eastern medicine. And I feel that, it's a harm to the patient to specifically say only Western medicine will work. You cannot even consider Eastern, medicine or philosophies or principles. And so I think ultimately to drive some of the change in the Western culture, it's going to take some empirically based and hierarchical evidence of efficacy and weighing the Western versus the Eastern alternatives. And I think a hybrid approach is going to be what will help drive some of these changes in society for medicine, because I think ultimately the future and the best way to approach it will be a hybrid based approach backed by evidence. So
I love the question, Robin, and I totally can see the value of what you're saying, Raji. But we're already seeing a lot of the Eastern traditions in a very ubiquitous way, becoming part of the Western norm. Everybody goes for yoga. It is part of the Eastern tradition. Yoga is part of the way of life in the Ayurvedic tradition. Just last week, I saw an entire week full of posts in LinkedIn. Western coaches are talking about the importance of walking bare feet on grass, laying down on grass. That's how the East lives. You walk bare feet, right? So as people put wellness and psychological wellness and spiritual wellness front and center, the Western medicine doesn't have solutions for them. So they are going to start coming in little by little.
Yeah.
And when it happens slowly, people are willing to accept it. But if you present it in a medical context, is when people freak out. So talk to us a little bit about why that is happening or how that happens.
Yeah, like when, I feel too, when you say that when you present it, abruptly versus you trickle in some of the, nuances of Eastern medicine, I think it goes back to the root of, humans and, their willingness to adopt change. When you thrust something new onto someone, usually they retreat and put up their wall because it's different than what they're accustomed to. So it's probably in a way, I guess you could call it a protective mechanism, if that is the case. But, it's just the fear of the unknown, something different. And so they're like immediately say, because I don't know anything about it or it's unknown, I'm just not going to accept it. And I think helping to educate them slowly on the nuances and the benefits, I think will also help kind of break through that.
Thank you. Go ahead, Bridget.
I was just curious what specifically the technology is that you want to apply, and how you see it mixing, because technology is quite a large catch-all.
Yeah. Yeah, definitely. So when it comes to some of the technologies, for instance, obviously, you can't even go on LinkedIn without like being bombarded by artificial intelligence posts and all this stuff like that. One of the components that we have with it that we're working with is the artificial intelligence angle as well. I remember when I first decided to jump, into the entrepreneurial route after graduating and my friend passing away. I had a conversation with someone that, I'll leave them unnamed, but they're doing artificial intelligence work right now. And they were confused and they said, why are you making the assumption that healthcare professionals even need to know anything about artificial intelligence and so forth? And now all they do is artificial intelligence. And this was years ago. So, one of the elements is, the AI component. And when we talk about the artificial intelligence, there's a lot of unknowns about what it's currently capable of. A lot of people just see Chat GPT and they're like, okay, that's AI. But, artificial intelligence has been around for quite some time in different settings within healthcare, well before Chat GPT came around. And there's different, abilities to leverage AI for use case scenarios that fall outside of the traditional scope. So we're going to be leveraging AI in the platform, but we're also bringing in elements of blockchain, et cetera. And one of the components within blockchain, and this is something when you mention blockchain, everyone thinks of like FTX and Bitcoin and everything like that. They go to the cryptocurrency. But there's a lot of different ways that you can tokenize and create the smart contracts and remove the elements of trust for the middleman in between, I guess, ledgers being executed on and so forth. Also, there's the immersive experiences like the AR, VR components that help drive, some of the engagement into the platform. So there's a whole host of different technologies we're working with. And one of the things that, I've been very transparent and upfront about this, because I don't ever feel that someone who is embarking on this journey without the proper context and training should ever be like, I'm the leading expert in this technology without the training behind it. And I am very humble about that. Where my expertise comes in is the medical side, how the practice of medicine, how the training of medicine. And I have an interest in the technology, but I work alongside my co-founder and CTO. He has done algorithms, AI, ML for over 13 years. He's led international teams with Charles Schwab, Accenture, head of data science for major corporations. And he's essentially my technical brain. So I say, this is what I would like to see. Is this something that's possible? And then he helps bring my technical vision to reality off of that. So I always bounce it off him. We work together, and then that's how we do the whole technology thing.
So if I'm sat in front of a GP, a doctor, how will I feel? How will I experience that technology as a patient?
Yeah, so of course, there's the different elements of the technology and the different settings. So one being the training side of things. So for instance, whether it be a medical student or a resident or even an attending physician that's currently learning and improving their skill sets, they have the different technologies that help augment their ability as they're independently learning as they go along. But then in the clinical practice and workflow, some of the ways that the technologies are integrating themselves into the actual practice of medicine is it's helping to remove administrative burden, at least more immediately. So that way the doctors can be more intimately engaged without having their face buried in Epic or whatever EHR system they're using. And that's one thing that I noticed too, is on my oncology rotation when I was in clerkship, there was a series of conversations where the physician was telling the patient for the first time they'd been diagnosed with this stage 4 cancer that was just found. And without breaking their face away from the screen or giving any way to the patient to brace themselves for this diagnosis, they just nonchalantly said, oh, you have stage 4 pancreatic metastatic cancer that's spread all over your body. And their face never broke away from their chart as they're typing. And I just remember as the medical student seeing the look of horror on the patient's face when they received that information, and the hyperventilating that occurred, and the wife was next to this patient just breaking down crying, yet the doctor was so into their charting and the note because they're going room to room to room. And to some extent I think they did that in a way to not get too invested into the thing, but you have to draw that balance as an oncologist. You have to stop what you're doing with the charting, sit down and face the patient and walk them through it slowly. And that's where I think technology can more immediately play a role, in those situations. So.
Brilliant. I'm so excited for you. Lots and lots of luck with what you're doing.
Thank you. Thank you.
I love the humane component that AI can help bring to the medical practitioner, because that is going to improve for the patient and their family the experience. So that to me is music to my ears, because I've been on the other side as this patient's spouse when that same oncological diagnosis was given with that amount of cold nature. So thank you for doing what you're doing, because it's going to positively impact all of us. Dr. Menon, I know you're ready.
Yeah. I unfortunately, being in the medical profession and having practiced for a while, I'm going to be the skeptic in the room with regard to AI helping tremendously on the patient interaction part, because the progression that I have seen, I started off with paper charts and being able to see more patients and be more present for my patients in the process. And then having to switch to EMR and be that person that had to face the chart on the computer screen and not my patient, and then now I'm in the phase where I'm in a part of medicine where I'm an ophthalmologist, so I have a scribe because we see almost triple the number of patients that a regular family physician sees to keep the lights on, so to speak. Because our reimbursements are, as ophthalmology, we're constantly fighting to keep our reimbursements and so my concern would be that exact thing. The more efficient medicine becomes, the less we get paid, our reimbursements get smaller because we're becoming more efficient. And so and it's a vicious cycle. And so my concern, is obviously I'm happy, that AI is there because pattern recognition will take a lot off of us, off of our responsibility. But the other flip side is also we make a lot more mistakes with our charting now, because personally, I know with the EMR, 75% of the chart is superfluous. It doesn't mean anything to me, and it's a waste of trees, paper, and my time to read it, to find the exact things. And it's a huge project, and I really commend you for looking into it and trying to change it. And I do hope a change happens, but I'm hoping you can tell me a few things to make me feel like what you're doing is going to make an impact and change how it's going to change where we're at now.
Yeah. No, 1 second, excuse me. I have a scratchy throat. Thank you. So when it comes to to address the first point, the paper of writing down the patient history, etc., to the EMR, and what the promise was supposed to be with the EMR. The promise was, by removing all the paperwork, that essentially you're going to have more time, you're going to be doing, your life is going to improve, etc. It, to be honest, had almost the opposite effect in some regards with the way EMR systems rolled out. And, I'm not going to say that it was perfect by any stretch of the imagination. We were promised all these things, and then we became glorified, cash registers with the EMR systems and so forth. And it became very, down to let's just pump out as many patients. And with some of those incentives, with the pumping out more patients, bringing more revenue, having our face buried in the charts, taking our notes home, and eating up into our family time so we can, finish and we're not backlogged. I think one of the things that with this EMR system that's done is it hasn't had the same effect that we were promised. And we're worried now if we increase the operational efficiency further with AI, will it amplify some of the things we've seen in the past and put it on steroids? And when you say that, going through their, patient history, et cetera, from maybe another healthcare professional or someone that jotted notes in, and you're trying to just catch up, see what's clinically relevant. I have heard many times when I was on my clerkships, that a lot of this is just copy and paste from another, chart. A lot of times they don't even read what they just copied and pasted. And, sometimes I've even heard of the name of the healthcare provider being just copied and pasted from another one. It's very clear that they just copied it really quick. One of the things that I think from the training perspective that we have an opportunity to help guide future generations is, to help improve the processes and the journey in which they leverage some of these technologies to use it in the right way, where it doesn't just amplify the training effects. So obviously the gatekeepers, before they go into residency, before they're in their fellowship attending, that's going to be an important area from the educational side. But when we do get into the clinical workflow side of things, we need to ensure that the ability to have a more efficient system doesn't lead to an uncontrolled spiral of increased burnout, because now we're seeing more of the problem, but at a faster rate. And so one of the things that we're going to need to ensure as we move forward is, ensuring that the system and the metrics change through which efficiency is evaluated. So let's say we free up 5 hours, out of your week or whatnot from some of these automated tasks. We need to ensure that those 5 hours are not like pumping more patients through and changing the incentive model of the system, because those extra 5 hours hypothetically could be used to ensure you're not burning out as a person, to make sure you're recharging your batteries. One of the things is we can't just free up time to say, okay, now you need to work harder in that free time, because we need you to be present. We need you to be alert when a patient comes rolling through the ER or whatever healthcare setting, that you're clinically sharp, versus running on like an hour of sleep because you were charting and catching up the night before. So
Yes. Yeah. I'm glad. I'm really happy to hear, that you're looking at those two things. And I agree with you that there is a lot of, gaps in the training that needs to be done during medical school or before residency and everything else. But my concern is, where in medical school do we put these trainings? Because for me, one of my pet projects that I'm trying to work on is working on self-empathy and communication for physicians, to do the other part of what you were talking about, where when you give that patient that news, we're taught it in medical school, but as burnout happens, you are correct. We kind of create, we're taught to just not process those emotions and just block it.
mm-hmm.
And move on to the next room, block it and move on to the next room. The nurse is there to do this, so we give the news and we walk out and let the nurse bear the burden of the caregiving, because we as physicians are the ones that are going to pronounce further good news or bad news, so we never get a chance to process the good news or the bad news. And eventually that leads into our discontent and our feeling of invisibility within our profession, and the trust erodes between the patient and us, which is also what we're seeing now with society and medicine in general. So, and looking at that model of, okay, so where do we bring in this, emotional awareness and management? Where do we bring in all of this? It's really hard to figure it out, because you and I both know how intense, how much we have to learn in medical school.
Oh, yes.
So I'm curious to see where and how, you're looking to incorporate this training within the medical school system.
Yeah, definitely. Yeah, I'm happy to have that discussion with you, and I think we should definitely speak further on that. There is definitely a need to figure this out, and the system in which I'm working to do this will track and ensure that these metrics are being hit. And anytime new information is brought into a curriculum, it takes about 5 years roughly before it shows up on the USMLE or COMLEX, and that ultimately dictates what value the medical school places on information, or the medical student places, because if they're not passing their boards, they at the end of the day, I know this sounds really bad to say, but if you don't pass your boards, you don't become a doctor. What value then, is it in learning all this other stuff and not passing your exams if you
Exactly.
learn it and then you don't become a doctor,
Yeah.
so it's a very interesting balancing act, and it's something that I'm working to address, and I'm happy to speak on that further with you. So
I am loving this conversation with our live audience. And I'm also excited that we touched on emotional intelligence and the ability to communicate with empathy and compassion. I'm also a believer that those are human skills we need to give our children as we raise them. Raji, congratulations. You're a new dad for a young little boy who's just beginning to crawl and walk. So I know you are going to nurture to raise him in a way that he is emotionally intelligent, compassionate, kind human being, because that's who you and your wife are. How do we get those capabilities into the human development till they get into school, so it's not a new skill they have to learn? Becoming a medical doctor or becoming a finance professional or becoming a business person, all of that can happen in the craft because the human foundation is already laid. To me, that is the right way to go. And so let's continue this conversation offline and see how we can make sure that we raise better humans so that when they go to university, we're not raising them as humans anymore. We're giving them professional capabilities and as credentialing so that they can go and do what they need to do to change the world in their area of specialization, because they already know who they are in their humanity. To me, that's where the power is. And let's work together to make that happen. So as we bring this to a close, Raji, any final thoughts, any nuggets of wisdom you have for us and our community?
Well, I often say, one of the sayings I always end on conversations, but I'll, continue past this is, I always say I'm going to stop being lazy, and I'll look this up, the exact verbiage of this quote, but how I've always operated has always been on a collaborative model, because, I feel that the lone wolf model by and of itself is something that is dying out, and thankfully so. As much as we wish we could fix the world and save the world all by ourselves, we're actually doing ourselves an injustice when we're not working with our colleagues and our peers and so forth. And there's this quote, something to the effect of, the highest order of intelligence in any given species is that of collaboration. And when people bring their minds together and their unique lived experiences and the challenges they've overcome, we as a society become much better for it when we work together to address the deeply entrenched problems. And one thing that, I, as a new father too, and I always laugh at my mom because I didn't think of how true this saying was. She told me that there's going to be something in you that's just going to flick on and change as you become a parent. And, I was like, yeah, sure. Like, but the second my son was brought into this world, it just seemed like I changed internally immediately when I saw him. And he took his first breath and he started crying. And, I have to admit, I actually had to step aside and wipe my tears in the bathroom because I started crying when I saw him come into this world. I think it's a beautiful thing when we can work together to help, our society out and provide a better tomorrow for our future. So
thank you so much, Raji. This has been a deeply meaningful and deeply moving conversation for me and our audience. So we are very grateful for the work you are doing, the openness with which you were able to share. And as you launch your business, we would love for you to come back and share with us some of the things that you couldn't share today because there are intellectual property protections and so many other things in place that limits us from having certain types of conversations. So let's have you back. Let's continue this conversation, and let's continue offline to figure out ways to be a part of this movement, because we all have a value to derive from this. We're all going to be patients. We're all going to be aging.
Yep.
And ultimately, as you said, we all need to leave this a better place for our children, our grandchildren, right?
Yes.
So just a call out there to re-emphasize Raji's message. We as a human community are only as good as our collaborative mindset, our ability to trust and bring our experiences together. It's what's going to help us change our current situation. So please take that step forward, keep the faith, and join the conversation, the movement, because ultimately the lives we are changing are our very own.
Thank you. Thank you.